our projects or included in our activity because according to the information that I received and that I have regards this topic, that there are a lot of opportunity to apply and lot of opportunity to receive some new support for this kind of the for this topic. Now I will add my presentation, and please, if you have questions during the presentation, stop me and ask me what you want to know more. I will as I'm sharing now the screen, I will not able to see what if you raise the hand or if you have some additional question. That please do
I
it.
can look about it. I can look on
Yeah,
the.
okay,
Yeah.
thank you, Bistra. That menstrual poverty and the menstrual hygiene management. First of all, I want to say thanks to WCF that we have a project Women 2030, and the projects about the water sanitation and plan that we are doing before 4 years, where we start to visit the rural area, talk with the ordinary people, especially with the women, and during this activity that we have raised the issue that the women have a problem with access to menstrual products. And after that, we have developed the necessity of the woman that they need more access or they need more space for manage their menstrual hygiene. And we start to explore, to investigate what it was written about this issue, about this topic, what we can find more information and everything else. But we find that there are not many information regards this topic, that not in the media, nor on school or at home. It means that nobody want to talk about the menstrual hygiene management, about the menstruation, about the topics, or that this is still taboo in our country. After that, we start to explore how it is in other in the neighboring country. The situation is similar or maybe worse. Concretely in Macedonia, no one media covered this topic. Even 5 journalists were present in the first press conference that it was done on this topic, that it was before 3 years when we have a press conference about our research. And can you imagine that the journalist came, but they doesn't cover the topic because they say that their chief and editor say that this is taboo, and who will now read this? Anyway, the data, it was really very bad, especially in the 21st century. But I will share with you some facts and numbers that 52% from the women in the world are in a reproductive age. In Macedonia, 400,000 women or girl are in a reproductive period. And what was very strange for us is that 6 million or 6,500,000 pieces pet or tampons are thrown in dumpsters monthly in Macedonia. Can you imagine which big medical or urban waste it is? That on Macedonia it's about 2 million citizens, that 6.6 million 6,500,000 pieces are thrown each month. Uh, in the world, it means that it's 13,000 till 16,000 pads or tampons that are thrown daily, and they need 500 years for um, how it's in English now, decomposition. That it means that need a lot of time to be used as waste. But what we can see that with trust, dignity, and without stigma, the woman can live with the menstruation. As today start the 16th day of 16 day of campaign against gender-based violence. I can say that we will have one of our activity will be that each woman and girl should be able to manage menstrual hygiene in peace, in comfort in the toilets, with trust, dignity, and without stigma, which is very important because we have few data that the girls in the school, especially in the rural area, doesn't go in the school during the period because they don't have a safe toilet. It means safe toilets from they are fair to be attacked because the toilet is always out of the school building. It's without the door, without the electricity, which means that they didn't feel safe and comfortable to go there, which means that we must be careful on this and always ask that it's very important, dignity and without stigma to manage the menstruation. Also, I want what I said that this is very important topic and that I will find a lot of support because this is for the first time that menstrual hygiene is underlined in some of international documents or international organization. For example, the menstrual development goal has no specific goal within the sustainable development goal, but is found, menstrual hygiene management has no specific goal within the sustainable development goal, but it's found in several of the 17 targets which show its importance. Before, in the millennium development goal, there was not underlined. There was nobody spoken about this. Now in the SDG 6.2, it said that the hygiene, it means the menstrual hygiene, is also one of the topic in which we can talk or we can try to achieve. Hence, the commitment to 2030, girl and woman should be able menstrual hygiene management to make it safe in privacy and with dignity. That this is say in 6.2, which means that we can start to work on this topic more and more. In SDG also, it's said that the menstrual hygiene management is mentioned in the 5, in the 4, in the 8, and also in the 12 SDGs. It means that they are looking for the gender sensitization, appropriate education, adequate location, and fair approach. It means that we can find many joint point with other SDGs, and that this is really a very important topics in which we should talk in the next year. Now I will share with you few data or few results from our research. This was the first research made in North Macedonia regards the menstrual hygiene management. And the results show that Macedonia does not meet any of the mentioned criteria for uh, conditions to can manage the menstrual hygiene management. The results show that only one private school in the country has condition facility for menstrual hygiene management. No one of the school has product for menstrual hygiene management. It means soap, toilet paper, water. I can say that till pandemic of coronavirus, the parents each month give one amount of money for the on the class for children or for teacher to buy soap, toilet paper for maintain the personal hygiene for the children. Also, no one of the school has appropriate facility for removing or for dealing with the menstrual hygiene management waste. 90% from the student in rural area in Macedonia doesn't visit school 4 to 5 days while they are in their period. 75% from the students in urban area doesn't visit school 2 till 3 days while they are on their period. The reason for this is the inadequate condition for managing menstrual hygiene in school or workplace, and the high price for product for menstrual hygiene management. About the conditions, 90% of the girls, they say they don't have any possibility or adequate toilets in the school for managing the menstrual hygiene, and 25% from the employed women, they say that work in open area and doesn't have access to toilets. About on the question which product are used for managing the menstrual hygiene, 80% say that this is the hygiene pads, and only 5% they say that they use tampon. But for us, what was very strange, and we were really very surprised, it is that 15% of the women in Macedonia do not use any hygienic products. They use uh, paper, or they use some fabric pads, newspaper, because it's a very high price, because of very high price of the menstrual product in Macedonia. This was really very strange, and as we cooperate always with the Institute for Public Health and with Professor Kochubovsky, who is responsible, or who is head of the sector for the water and hygiene, he said that this is very clear why now for him it's very clear why it's decreasing the number of infection of the woman health the last few years. He said that now for him it's more clear, and that we must find a solution. About we have one question, if they use the menstrual cups as one of alternative. I can say that only few of them they were familiar with this, but no one used them. 63% of women say that they would use a reusable hygiene part if they have it, or if they can find on the market. Unfortunately, in our country, it is not possible to find at the moment. And 70% of the respondents are not aware about the pollution caused by hygienic waste. Of course, this give us open us a lot of question and lot of possibility, lot of challenge for the next step. One of the challenge was the finance challenge. That say that a five-member family with mostly a woman member, monthly, and the monthly salary of 12,000 dinar, which was the minimum salary in the period when we have the research, monthly should spend between 8 to 10% from their income on hygienic products. Believe me that nobody will do it this. Uh, Firstly, they will buy food for the children, then they will, and after that, they will decide if they will buy the menstrual hygiene product. Just for this they use newspaper, or they stay at home and doesn't go on the school. The education challenges is that in the educational program there is incompatible topic about personal hygiene for children, and even less for menstrual hygiene. It's still a taboo topic, and stereotype exists, and this is not spoken even in the circle of the family. When we ask the children if they spoke about menstrual period at home, I can tell you that from 100 students from 12 school with mixed ethnicum, on the question and how to manage it, 6% of the girl and 1% of the boy answered with yes. From 100 surveyed girl in the age among 12 and 16 year, 80% heard about menstrual period from a sister or a friend. No one from the mother or father or from the teacher in the school, which means that parenting education is also necessary. Um, the other challenge is it's appropriate facility in school, appropriate hygiene products, high cost of funds, lack of appropriate bin for removing waste, that we don't have um, real waste management regards the menstrual waste, inadequate education, and what we can do with directive, EU directive 2019 slash 904 on the reduction of the impact of certain plastic product on the environment, when say that till 21st of July next year will be banned a single-use plastic, in which is include also the product for menstrual hygiene management. What are the alternative and benefit? It's ecologically safe product for managing menstrual hygiene, reduction of menstrual poverty, infection, and pollution. I can say that we will just start projects Eco Budget Mama. It means that it is project for development, the social enterprises who will start to swill the ecologically safe reusable hygiene pad for the woman. Very often they tell me, but this is the time of our grandmother. Yes, but I say yes, but in the country as Macedonia, when we cannot find or we cannot buy the reusable pads, and where they are very expensive if they will be imported from European Union. I don't know if you have it in the Union, that we can start and try to develop as social enterprises, because a lot of women they need it and they will be more safe and more healthy using them, but also the environment will be more safe after that. um, the other thing, what is the requirement? What we do till now, we establish a fund for eradication of menstrual poverty. Now we implement, or it's ongoing, the project for the reducing the tax rate of the menstrual hygiene on 18 to 5%, because in our country the tax of the menstrual project is 80%, and we are asking to be increasing on 5%, and we have a big campaign on that. Also, we are looking for benefit for a company that they will support us in the process of eradication of menstrual poverty. It means that each of them to buy the menstrual product with 1% of their profit, and give to the fund for eradication of menstrual poverty. Also, access to accurate and pragmatic information about the menstrual hygiene, access to private facility, access to water, soap, and waste bin in the toilets that provide privacy, and adequate education. I can say that with the support of the British Embassy in Skopje, we have reconstruct a few toilets in a few primary school, and in this school we have per one toilets that it's adapted for menstrual hygiene management. It means that in each cabin it was the hot water, that it was the paper, that it was the bins for collect the waste, and also we provide the free of charge product for girls in that school, for girls in that school for 1 year. And our aim is to be as in England, in UK, or now in part of France, to provide free of charge menstrual hygiene product for each girl that go in ordinary in go in the educational process that are involved in the educational process. Also, our aim is, as I say, to reduce the taxes and to make sensitive gender budgeting. We already have initiative in few communities that they are on the way to put it the menstrual hygiene management in their gender budgeting, which means that they will provide free of charge menstrual products for the woman in the public institution as well for the girls in the school, and they will adapt a pair one toilet in the facility regards the menstrual hygiene management. This was our project, this was our activity that I share with you, and I believe that this is good base to go ahead and to work together in this possibility to growing awareness and adapt the toilets on according to the criteria that this is not our criteria, this is the criteria set up by World Health Organization and the UNEC Protocol for Water and Health, in which uh, part we are involved. Then, if you have some question or if you want to share how it is in your country, it will be good. As far as I know, because we have made some research regard how it is in other countries, that the situation is very similar or worse. But it will be good to share the experience and to things what we can do together in the next years or next steps. What will be our next steps? Thank you.
Thank you very, very much. Very nice introduction of the topic. And yeah, we have to think how we can go on further with this issue in the region. It's very important. Yes, Verena, you wanted to say something? Please go ahead.
I just clapped virtually.
Ah, okay.
Yeah, so thank you for the presentation. Yeah, we have a big media campaign in our activity list in Macedonia, so I think you have quite an opportunity there and possibility to further focus on that issue. And maybe, I don't know if that's one of your ideas anyway, to make a new survey or further or expand the survey, or I would be very, very interesting for us to continue on that research, what you already did. So we are very open in concerning the BMU project on that. Yeah.
Okay, thank you. Yeah, also, I believe that if you have information for each of country involved in the project will be easy and we will be more, we will have a good possibility to go ahead. I remember that because before 2 years when we have a meeting, our final meeting in Geneva, that it was really very big attention to the topic. And I think that this is still in life and it will be in life, especially because the World Health Organization they now they have some new direction about the equity, about the topics of how to manage and what to do with the menstrual hygiene, that there are a lot of open possibility. And as I have heard uh, lot of attention it's now putting on that on that topic, that we can use it because, as I say, we have experience, we have a possibility where I can say for the region at the moment we are known, recognizable on the topic, that we can use this benefit and go ahead.
And thank you, Natasha. Really, it was a very good presentation. Quite informative even for us as media contact, because we have not been involved prior. And coming back to your not question but also somehow issue raised, is there such information as you presented for Macedonia also for Albania or other countries part in the project? So because then we can either work more on trying to have a baseline, let's say, view on the situation also in other countries. And then linked with what Philip mentioned earlier, it can be a very good information for example, infographics. If
Yes.
we'd like to see a kind of an, let's say, regional overview and data given.
Yeah. Yeah, thank you, Albona. This information is only for Macedonia because we have made research for Macedonia, but I can share the research with the question, and each of you can use it for your country and to make it to be the same and to make some analyze for the region. Yes, of course, we can make a lot of infographics or posters or information that we already we have it, but we can make it together and uh, adapt it to be regards the projects and regards the aim of our projects, of these projects.
If I may say something, sorry, Natasha.
Yeah, please.
So, Valbona, it's great idea, especially because you can start, especially with the campaign for reducing the, uh, how to say, taxes, reducing taxes for the menstrual cups and other things. So, this is always very actual. It's very interesting because the government by default say no, we don't like the taxes, but that increase your visibility about the issue, about the problem. So it will be great start, and of course the research, or how to say, what we have like resources, it's also open, and those idea about comparison with the infographics, great. Thank you.
If you're interested or if you want to focus in the project on MHM, we can also, when we develop at the beginning of next year, when we develop the education material, we can also there focus on MHM, so do the trainings with the teachers and the students, like to have an extra session on MHM. So we are also very open on that. So as we don't have any fixed material, I would let it open to you if you say what is
Yeah.
most important or what you think is most important and you're most interested in. So
Yeah, if yeah, I want thank you, Verena. Yeah, if you decide that we need some training for children, I can share with you. Of course, we should translate it because we have training with the children from the secondary school in Macedonia. It was immediately after the lockdown in Macedonia, March, April, and we have more than 1,000 children that they follow this classes. It was reported by National Agency for Youth and Sport, and it was really very successful. And we have a lot of information and a lot of feedback from them. Then we can share and use it because they, of course, that we can upgrade and make it to be more. Maybe you can change something to be more adapted to your countries, but it is anyhow useful.
Just to mention something on the it is, we have to have into consideration that this can be only extra activities next to all the activities which are mentioned in our project. So please have this in mind, and of course I'm very much for going it for it, but we have to be a little bit it should be the next step after implementing all the rest of the activities, or it should go together, but it shouldn't take the whole time because the topic it's very good, and most of the people who are funders or institutions who would like to take care of such kind of activities, they might decide that this is the main topic which we are dealing with. So please, it can be only an additional and extra activity to our main project activities.
Okay. Yeah, this was my presentation. If you have some question or something to add, you're welcome. I will share both the presentation in our Google Drive.
Super.
After this meeting, you will have it there. And
super, thank you very much. It was really, really interesting, and so much can be done on this topic in the region. So
yeah, I hope
we can think for further activities and further project applications.
Yeah, this is very I believe that there will be a lot of possibility, because now they are open and they are talking more and more on this.
Yeah,
especially with in the time of pandemic, because one of our joint project with how it was menstruation coalition, it was the menstruation doesn't stop during pandemic. That it means that it's really very, very actual, and we need to
yeah, exactly. Yeah.
Okay, then thank you very much for your time. Thank you to be present in our training. I hope that you have not learned but heard what we are doing and how we are doing, and how we can go ahead, especially with the social media and for our visibility, and start to work.
Yeah, thank you so much, Natasha. Just for all of you, Valbona has created a sheet in our Google Drive, an Excel sheet where everybody can put in what tools, what social media tools he or she is using. Then we have a second sheet with a summary of the hashtags. Super. And a third sheet with a summary of our project. So that we might use for our social media launch. But as I said, it's not that catchy. It's just a summary of our project activities. You are very free to change it, however you like.
Thank you, Valbona.
Thank you for all so.
Thank you very much. It was really useful. I'm looking forward to working further on this.
Yeah.
So see you. Be in touch.
Okay. Stay in touch. Stay safe.
To have closer talks to you within the next days. Yeah.
Have a nice rest of the week, and we'll speak together in the next week as well.
Yes. Yeah, of course. Okay.
All the best.
A nice rest
Bye.
of you.
Bye.
Bye.
Thank you.
Bye.
Thank you very much.
Stop. Wait. Photo. Wait. I will now stop recording.